There you go.
Hi, good afternoon. Today is October the 18th, 2023, and it is 1:03 p.m. As a quorum of the committee is in attendance, I would like to call to order the meeting of the Central Health Strategic Planning Committee. As a reminder, some of our committee members may also be participating by video conference, so the staff will be managing video and audio feeds of all participants closely to make sure we have a legally compliant meeting at all times. The first order of business is public communication. Members of the public who wish to make comments virtually during the public communication portion of the meeting must have registered with Central Health via the online form or by telephone no later than 11:30 a.m. today. We did not have anyone registered to make comments today, so we will proceed to the committee agenda. Review and approve the minutes of the September 6th, 2023 Strategic Planning Committee meeting. Dr. Martin, would you begin? Great.
I second it.
Thank you. All in favor?
Aye.
Right.
Aye.
Anyone didn't deny this or what? Yeah, no.
Any opposed?
Any opposed?
Yeah.
No. Okay. All right.
Motion carried.
Motion carries. Number 2, receive and discuss updates on Eastern Travis County service expansion. So Ms. McDonald, Stephanie McDonald, will be presenting items 2 and 3 in open session before we go into closed session. So there will not be a motion on this, but we will be going into closed session, especially over any questions that may arise that need to be discussed in closed session and also to discuss with the lawyers. Thank you.
Thank you. There will be no costume changes, but it is a one-act play where I star in the whole show. So we'll start with the Eastern Travis County update, and this is really exciting. And if you'll advance to the next slide, I hope that you will all join us this Saturday at the celebration and ribbon cutting for the Hornsby Bend Health and Wellness Center. If you want to go to the next slide for us. We are encouraging costumes at this event, but we will have, I think, a number of folks. Paul and the community engagement team have been working very hard with my team to get the celebration started. I believe 10 o'clock in the morning on Saturday at 3700 Gilbert Road. That's really important that you put Gilbert Road 78725 in your GPS. We have been doing a lot of outreach for the event, and we will have food and other games and activities. We've had some folks helping us. We walking and passing out flyers throughout the neighborhood. Next, it's just we did it in English and Spanish. Next slide. So here it is. If you have been following this, the building is actually complete. And it's with the playground. The inclusive playground is also final stages of completion. If you'll, next slide. If you're not able to make it out this weekend, we would love to give you a tour. On the left is the check-in registration area. This is also where the Central Health Community Resource Associate will sit. And then on the right is the care team area. And it's a really beautiful light-filled space. And we're really excited. Unfortunately, we've had a little bit of setback. Community care has had a little bit of a setback in delivering clinical services at the site. We, as you know, community care is under the oversight of the Health Resources Services Administration and Division of CMS, the Centers for Medicare and Medicaid Studies. They have a requirement to work with HRSA in establishing new addresses and new locations. HRSA has kind of changed their process recently, and even though I was misinformed, but I am corrected.
Excuse me, this is Anne. We seem to have lost the feed of the presentation, just FYI. What we're seeing is the Oh, I'm sorry, it's here. My apologies.
So HRSA has a process. They've changed that process recently. And even though Community Care still has a dedicated kind of program officer, the process to have a new address, or in this case, HRSA's deemed a new location, added as a service site, has become a little bit longer, and it requires a review process that they had not previously done in this kind of instance. This is a new location for some reason. I can't explain why, but for not just an address change. And because of that, it is going to require this more robust review and a longer process and a delay in the clinical services at the site. The existing location will continue to see patients until they can make the move. And I do think that's important for you all to know that the reason why they can't just say, hey, we're going to open up the site is that there is the issue of their Medicaid billing, and HRSA will not permit them to bill for Medicaid services until they have officially recognized this as a new location. So we are staying tuned and very hopeful that this can happen in the next couple of weeks, but we will give you more information as we get it. Again, we will open the site as soon as we get the green light from the fire marshal and offer health and wellness services. We believe that's imminent, by the way, and offer health and wellness services. We will have eligibility services, connecting people to eligibility appointments virtually from this site. We will have other services on site and other programs. I think we've already had some interest from WIC to have their delivery occur here, their monthly deliveries, as well as the Garfield Public Library District wants to have a bookmobile in the parking lot. So exciting, and kudos to everybody who have made this possible and who are working to create the wellness programming that we know is really desired by the community here. Next. We've got Del Valley, and I do want to let y'all know that there is progress being made in the Del Valley Health and Wellness Center. Next picture, please. We are in the interior already doing work on kind of creating the rooms. Next slide. And the box itself is complete, and we had a roofer on site this week. Hopefully the roof is all in place. And I do want you to know that we are making some progress there. And I'll talk to you a little bit more about the Del Valley Health and Wellness Center in closed session. Next slide, please. The third Eastern Travis County project, it's here, Colony Park. And I want you all to know that thanks to my colleagues, we are working on developing and firming up the clinical program, what it is the building will do. And we are also talking about the wellness programming and the health programs that may be outside of the clinical space, what that might look like. Do we want a community kitchen, for example, here? Is there any need to really work on addressing food insecurity at the site? And so a lot of more conversations. I have a new project manager that started this late fall, and he has been assigned to this project. We have a solicitation in our procurement queue for design services, and we're working with the city to coordinate the infrastructure for the project. So a lot of good work, and I hope to come back to you with more progress on Colony Park. If it's okay, I would like to move directly into item number 3, which is going to start with a reveal. This is the first time that I think you all will get to see renderings of the Hancock. We're calling it Enterprise Headquarters and Multi-Services Care Site. Maybe that will get shortened.
Yes, Stephanie, we have a question.
Okay.
Manager Jones.
Yeah, I just have a quick question. On the, I don't know if you can go back to the slide of the entrance at the Hornsby Bend, where it has community care. Is there going to be a visible central health?
So we are actually on there's a giant porte cochere driveway, and there's a big Central Health logo, and there's a shared way. I have a picture. So this is actually when you step in to the registration building, into the registration desk. There's a lot of Central Health branding. And I think part of this is just waiting to see how some of the branding efforts are going.
Yeah, I think in light of the challenges we've had in terms of getting the message about what we're doing in the community, as more visibility we can be, not only in other venues, but in the clinics, I think it will be helpful, so just to consider as we build these other new facilities as well, so I just.
Absolutely.
Thanks.
Yes, Manager Valadez.
Stephanie, is there going to be an opportunity for,
Mike, it's on. It's on.
it says red.
It's on. Yeah. We're good.
Okay. You know, when we did the Southeast Health and Wellness Center, we had pictures and murals put on the walls so that the community members could come in and see people that they recognize. I saw families that I knew, you know. But is anything like that going to occur?
So I don't know if you remember, but we've been talking a little bit about this as part of this design process. We worked with the Delaware Valley Independent School District and their art program. So we actually, and Jeff had to pay the bill the other day, and he had to call me on this, but we have actually worked with the art program and the art club, and we have student art framed appropriately to meet Joint Commission standards in clinical spaces, but it is framed throughout the building. And then we also have a large mural that the art club did at the high school, and
great.
that is being installed as well. That's
So-
the one that I don't know if you remember has the jackalope and a wolf.
Yes.
That's
yeah.
and the
That's
cardinal from Del
That's
Valle.
at Del Valley.
That is at the Hornsby
Oh,
Bend
Hornsby
site.
Bend. Oh, okay. Okay.
Yeah.
And is there going to be a picture of what the shared space is going to be? The playscape and the.
We hope that you can make it on Saturday, but if you
Yeah,
can't,
I'm trying to
Okay,
right now.
yes, it's beautiful, and you should come out there and we
I
tried
wanted to
it
make
out.
sure that there was stuff for those that can't walk.
Yes,
You know,
in fact,
wheelchairs.
come on out. We're very
Okay.
excited about it.
Thank you.
Yes. And if you can't make it Saturday, we would love to have you come and, yes. Yep. All right. Item 3? Okay. This is,
No, wait, let me read it. Okay. So there is, of course, no motion on number 2. All right, I announce that the committee is convening.
no, we're
No,
gonna,
no. I want to go
Oh.
just read the agenda item.
Oh,
I think it's the second.
okay, number 3, right?
yes, we're going to
Yes,
number 3.
okay, number 3. We're going to discuss Central Health owned or occupied real property and potential property for acquisition, lease, or development in Travis County, including pending issues and next steps in the redevelopment of the Central Health downtown campus, administrative offices of Central Health Enterprise Partners, and new developments in eastern Travis County.
All right, so here it is. We have been very busy and engaged with BGK, who is an architecture firm based locally in Austin, and BSA, who we work with a lot on our healthcare facilities. And they have been working for the greater part of this year, and we are kind of concluding the design development phase. Sometime in November, we will likely start actually putting construction documents together. And the goal is to have those construction documents ready at the end of this year. I'm also really pleased to report, and thank you to David and many of the people on our team, procurement, Misty. We actually have a contract with the construction manager at risk, and this is really important for us as we have this very large project with many moving parts and making sure that we have the right construction expertise at the table. So it's my pleasure to let you know that Rogers O'Brien is the construction manager at risk for this project. They are a Texas-based firm, but have a very considerable portfolio, do a lot of work in the Austin area on significant projects of this size. So really, really pleased that they are joining us. We will use the construction manager at risk with the design team to make sure that we are saving money where we can. And so what I'm going to show you today is kind of the architects. And we have, priced this with the architect's cost estimator, so we have some idea that we are within our budget. Hopefully the construction manager will come back and say, well, this makes sense or this doesn't make sense. So I want you to know that these renderings are draft and that there may be elements to them that need to be modified or things that will have to change, and really in order to keep within our budget or also to meet some of the other criteria that we have for the project. So next slide, please. Just to orient you and to kind of get you a sense of what they are thinking about. If you look where the trees are and the little bushes on the right, those are trees. They will be in the sidewalk, and that is the east side. I-35 is to the right. The entrance, as per our closing documents with Regency Centers, is there in the lower southeast quadrant there. It will have a porte cochere, and then on the second floor is kind of a canopy for the staff and the break room that they have upstairs. On the north side of the building is also an entrance. We think that we will have a lot of the accessible parking available on the north side. And then there is this dedicated staff entrance, as well as a courtyard for the break room for the clinical staff on the ground floor. We are keeping that loading dock and some of that back-end function that was there for Sears, and we have need for that loading dock, so we're really excited to have that. There's a area that will be a part of the HEB Breezeway as in their expansion plans that we are working with them on. And then, on the south side of the building, there will be, we hope, windows and light that come in, and we'll show you a little bit about why the light is important for us on this ground floor. So that's just the overall site. Next.
Is the north, top, and south,
Yes.
east?
East on the right, west on the left. So HEB is on the left. Okay, here we go. Next picture, please. This is current, and this is next one. This is proposed, and so this is what this would look like for the main patient drop-off on that southeast side. Next slide. So this is the approach again for the main entry. If you'll change, there you go. If you come into the building right now, and those glass doors on the right-hand side of the brick wall is the pharmacy, which is why it is bricked like that. And bollards or some other things are going to be really important for us for security reasons. But we did want to make some sense of a kind of courtyard, and for people who are waiting to have a place to sit that's, in the shade. So that shade on this is on the second floor. The lower canopy is actually solid to protect people from the rain. Next slide, please. So this is the side that faces kind of the, yes, Wendy's and Firestone, there you go. And if you'll see on the second floor, that's where the administrative staff would have their offices, and the lower level underneath there is the clinical floor. One more side, there you go. So this is the back end where the garden center was, and this will be now, there will be public entrance on the left-hand side there, and a staff entrance on the right. And there will be a courtyard with a kind of fenced area, hopefully, with some landscape, but to separate the two. Next. There you go. That package pickup sign has endured the elements. It's amazing. We're screening some of the mechanical elements on the roof there, on the top. Next slide. We're going to get into the interior, and I think I've shown some of this to you before, but just to orient you again, on the bottom right, yellow is actually the lab that will serve patients throughout both community care as well as central health services. If you come in through that east door, that's kind of a central spine. We've been jokingly referred to this as the interstate, so this is I-35. The orange area would be the community care services check-in and registration areas, and then behind that orange line there would be, starting from the bottom, pharmacy. That would be for everybody within the system eligible for those services. Up just north of that would be primary care. Just north of that would be David Powell, and then just north of that would be adult dental. On the other side, where the kind of green color is, that would be mostly the top kind of L on its side is kind of back of the house function, as well as where we would have staff break room. Just south of that would be some of the clinical services that Central Health would likely provide, including imaging and diagnostic services. To the green lower is is more Central Health, and all of that to the left there would be specialty care services provided most likely by Central Health. And if you would go all the way down, that purple area would be the primary registration area for the Central Health specialty care services. And then just to the south of that would be offices for eligibility or financial screening, and those will likely be shared between the entities. So that's kind of our current proposal. I think if you'll go to the next slide, we'll start talking about interiors. And there is a lot of brick actually in the building. And if you don't really know that, if you think about the Sears though, and a lot of it's been covered with the stucco and the ephes for many years now. But so they want to bring back the brick and kind of extend it. We're looking at really durable materials and making sure that we can try to take advantage of the existing structure where in elements where we can, including in some places the flooring. And making sure that all the surfaces can be easily cleaned and stand up to the kind of medical grade detergents that we need to use. Next. So I do want you to know that I've presented this to a group of Central Health folks who are participating in our Diversity, Equity, and Inclusion Committee, and they really liked some of these colors. We've also run them by the Community Care Leadership and gotten some feedback. So these are still in play. I don't want you to think that we've landed on these, but I think there was this is a proposal for the lab area, and one of the ideas is maybe to use something that is more mint colored, and that is because in some of the other areas where we have shared services between the organizations, we're using kind of more of that mint color. So just so you know, these are some of the conversations that are still underway. Next. This would be the proposal for the Central Health site. The chairs look like they're fabric. They will likely be something that's wipeable, cleanable. So I don't want you to think that that's a fabric. And we're being very mindful of having furniture that is flexible for families and for people with special needs and in different sizes, especially, coming in with strollers and lots of bags. That's usually how I come in. But also making sure that we're taking safety into account. The furniture will likely be very heavy and not move. Next, we really like these blue colors, and I think we're going to keep that pretty consistent in the clinical areas, especially on the Central Health side. We are really working on directional cues within the floors for both staff as well as patients. I haven't told them this yet, but I'm going to ask the community engagement folks to help me with a patient focus group on getting some more insight about how they might or what they use to navigate within a site, especially since we don't always have the luxury of having readers and having a literate audience that can read something. So we're really working on. So there's some discussion about using the walls, for example, to do arrows to main hallways. Next slide for me. This is the dental area. And we got some really interesting feedback. Some of the community care leadership really hates orange, even though that is one of their principal logo colors. But we do we like kind of the more ochre color, and I don't want to call it burnt orange because Mike's in the room, but there's, some more, I think more of those earth tones and kind of in keeping with the brick. Next. So these are all the kind of community care clinical spaces. Next slide, please. And then this would be your room. This is the auditorium that we would have board meetings in and events. The way that we are designing this, that white stripe in the middle, there would be a wall, a flexible wall that you could pull out and divide the room. Community care has need to have all provider meetings, and this would allow them to have, one set of providers on one side, maybe nurses on the other, that kind of arrangement. So we are really trying to be very thoughtful around the monitors and the placement, cameras. We are also looking at new technology. I had a really great conversation with Molly Beth Malcolm at ECC. They did a new dais kind of structure for their new Highland Highland campus boardroom, and she told me she hated it. So I was like, well, that's great feedback. So we are trying to find something that's flexible, but that also has all of the AV components. We have heard you all and wanting to have more kind of technology and less paper. So those are all things that are going into our thinking. Next. So this would be, if you remember, there was an escalator for the Sears. There's no longer an escalator. We would rebuild the stairwell. The stairwell, though, would only go down, and it would not go up to the second floor. there would also be elevators for the public, and but we really want to make sure that we can get as much light in that ground floor down into this level. There will be other offices down here. There is kind of a glass
Oh,
looking.
could I ask a question?
Of course.
I may have missed what you said about the stairwells. Are there stairs going up to the second floor?
There are not public stairs going up to the second floor. So there will be stairs for staff to go up to the second floor and the side on the north side of the building. And there will be some stairs out for egress, for emergency access, but there will not be stairs upstairs to that second level. The elevators will take you directly up to that second level.
I'd like to just make a statement about that, or I'd just like to point something out. You know, for health purposes, and we are Central Health, it's just from my perspective, for health purposes, it's important for people to be able to take stairs. And particularly when you're talking about one floor. So I would really, I mean, I know you're far along in the design and you're not asking us, I mean, that's not our purpose here. I just want to give you that bit of feedback. I think that's a problem, to only be able to get up to the second floor with stairs unless you can find the staff stairs in the back.
I think that we are really trying to keep the public functions downstairs, and that was really at the request of some of our
Okay.
partners. So
Okay.
the only people upstairs would need to be escorted. Or
Okay.
they would take the elevators to go to the public area, and we'll talk a little bit about that. But I'm very happy to, take that feedback.
Okay, well, I just want to provide that as feedback. And I hear the explanation about the second floor not being one that's that accessible or not intended for the use of public. So I hear that. So that might be the solution there. I just really wanted to point that out, that I think it's important to have options to be able, people not have to take elevators. Thank you.
If you want to go to I'm sorry, there is a box that is another large meeting room. We would have that for the community care board, but it could be used for other meetings as well. And then there would be an executive session room for this body in behind the auditorium.
Is that shown somewhere in the layout?
It's I don't actually have a layout slide here. I can show that to you. We're making some revisions to that space and making it larger. We had a storage room next to it. We've taken out the storage room, so I'll come back with that in the future. So to Manager Kitchen's point, the idea is that you would take the elevators if you were coming upstairs for a meeting or for some other reason to meet with the staff of any of the entities. You would come up the elevators, and then these sides are access restricted, and you would have to check in with a receptionist at the front. And we're still working through some of this, but it would have to be badge restricted on both sides in this case.
Manager Kitchen's question. By law, you have to have stairs to go up to that level. It's just not open to the public.
Correct.
Is that correct?
Yes.
Okay, so staff could go up
Yes,
and
there
down
is a
with their
staff. There
badge?
is absolutely a staff elevator bank on the north side of the building and stairs.
Right, okay.
And then there are emergency stairs in the south side of the building. If you want to go back, I'm sorry, if you go back one slide. So in this case, we're not on the clinic floor, so we have a little bit more flexibility in materials, and I just want you to know, got a lot of good feedback from the staff around some of this glazed brick and this green color. Next slide, please. And that
Can I ask
is,
a question?
Yes.
Excuse me. So, so the staff stairs are not locked down for the public. The public can take the staff stairs, right?
no, they are behind the clinical. So in order to get into the building from where the staff stairs are located, it is access badge restricted.
Okay, so there are no stairs up to the second floor that are not access badge restricted.
Correct.
Okay, and so the thinking is that if a member of the public needs to go upstairs, that they'll be escorted, but they could be escorted upstairs and not an elevator.
If they need to go up the stairs, they would have to be escorted, yes. So they can
Yeah,
go
I
up the elevator. The elevator is open and it takes you right into that central lobby.
We can talk about it more offline. There's a lot of reasons that elevators are not as healthy for people, And they're important for some people to have, but for some people they're not. So, so I just wanted to have some awareness of that, you know. So,
Some,
Rendering volume where you had the stairs.
yeah,
I'm just trying to get a perspective of, you're right there. So these stairs here are going to be from the lower. No,
I'm sorry, I can't hear.
I'm sorry, I had my mic off.
Yep, there we go.
So I need to repeat everything I've said today already. So looking at this rendering here, this is a lower level going to the ground level, is that right? Okay, so, and these are clinical offices are going to be located here.
so the clinical floor is on the ground floor. So when you come in from the street, you come right into the clinic space, and that will be open.
That's the lower or ground?
That's the ground. Then if
Okay.
you're going to come to, say, a board meeting or let's say we're having a program on diabetes education, you would go down these stairs or up these stairs to the ground floor where the parking is. So the parking level is on the ground floor. That's where the surface parking is.
Okay, so this rendering appears to see that there's a gentleman coming down the stairs there, so there is open to
Yes,
the
so
public.
if you're going downstairs to where the meetings are, where the public auditorium is, that is absolutely
Okay,
open. So you can go up and down from the ground floor where the clinic services are and the pharmacy and lab, and go downstairs to the public auditorium space where there's some other meeting rooms, and there are some other offices down here. And you can go up and down these stairs between the two
Okay,
floors.
okay.
I think that was what you were addressing, was it Manager
Yeah, that
Kitchen?
was not clear to me, so.
Yeah, me either, but I
It's
understand
just
it
the
now.
office level
Yeah,
where there's PHI and other things happening that need to be behind access restriction.
Which is the
Third.
third level, yeah, okay.
Yes. Well,
Thank you for
Manager
the clarification.
Valadez
Thank you.
has a question. And also, I'm just want to repeat that any sensitive questions, we might want to wait till, to close session. But regular questions.
I thought we were gonna allow you to finish your presentation before we asked them.
Okay.
Do you,
I'm happy to,
okay, so when you went back and you showed us the entrance from what would have been the parking lot that DOT is gonna take from 35? Okay, because that is an opening, is there not an entrance there?
there is on the east
Okay,
side.
and you
That's the
show, and
primary
it shows,
opening.
on the second level, is that going to be, a place where people can go out, those that are on the second floor?
Just
is-
staff.
No, I know, but are people gonna be able to go out onto that second level, which would be facing 35,
Yes,
and sit down or talk or take a break or whatever they can?
yes.
Okay. So then throughout this presentation, I didn't know if anybody had given any thought to the fact that we don't know what we're facing in the future. I don't know if there's going to be another pandemic. I don't know if there's going to be, someone's going to shoot bombs at Austin, Texas. I don't know if there's going to be flooding or severe weather. And I didn't know whether or not anybody had given any consideration to possibly having some space where the offices would be locked down, but public could come in, like for a heating station, for heat, whether or not they could actually utilize that space for emergency purposes.
So this lower level, including this public auditorium space, portions of it could be used absolutely for the public
Okay.
in those environments.
But what I was saying is, for emergency purposes, are we going to have a space, like in the old days, I grew up in a small town. The basement of the post office was always a emergency center for hurricanes or tornadoes or whatever was coming. So
Yes.
everybody could go there, that nobody had basements in Mission, Texas.
Well, we do.
But
And we
that's-
recognize that public auditorium, maybe, now I'm going to step back and say we are doing some analysis right now.
For tornadoes, it's
What
like
we don't
bad
think we
weather.
can do is offer ourselves as a true heating or cooling center
Correct.
for the public, because we cannot provide and generate a consistent amount of power besides what we need already to keep our vaccines and our medications and our, the other things that require. So we have, we are designing right now, we have a generator. The generator will likely be fed by natural gas, so hopefully it will be on when we need it. But it will likely only be able to power some critical infrastructure. So it will power our servers. Hopefully it'll power our servers, our red plug items, vaccine refrigerators. Some of the pharmacy is one that has a lot of critical kind of temperature needs, right? I cannot guarantee that this will be air conditioned at 70 degrees in the middle of the summer if there was a power outage.
Okay, another consideration would be to take into consideration the people who work there. What happens when it's so bad outside that they can't get home?
So
Is there going to be space available for them?
We believe that this space will have some level of power in the adverse storm situation if there is no power for for a pretty long period of time, because hopefully the natural gas is still going, and that is something that we recognize is not a absolute, right? We can't always.
Forget ERCOT.
So
I did say that.
my husband works for Austin Energy, so I'm very sensitive to this issue. But I think, we are looking at those things and things like solar panels and some other ways and we are trying to meet, there are sustainability standards that the city requires of us that we are having to meet. And then we would like to, work through the Austin Energy Green Building Program, and it's a different iteration now, but there's a level that we are trying to meet. It's not the top level, but
No,
it
I know.
is to try, but there's, for example, just the
Sustainability,
glazing on
survival.
the window to reduce the heat.
But that is one of the considerations that I
Yes.
would have taken into, what happens if we're in a meeting, here comes a tornado, or the weather is so bad, nobody can drive?
There is no better place
Okay.
in my mind in Travis County probably than in that boardroom, which is in the
Okay.
center in the lower
Perfect.
level.
Thank you.
Okay. But yes, we are absolutely thinking all those things. And then, this is just a rendering. The meeting rooms will likely have glazing over some of the at the center of the window, so you can't exactly see in, but you can tell if the room is occupied. Lots of discussion and desire to have technology that allows us to reserve those rooms, and so those are some of the conversations we've been having. The workstations, this is just, you've seen kind of some of the flat floor plan. This is just a visual rendering. We are really trying to reuse as much of our existing systems furniture, and we're storing a lot of that right now at Cameron Center. Next, I think we're wrapping up. That might be the last one. Is that the last slide? All right. Any other questions about Hancock?
Manager Valdez.
Yes, also, we'll be able to have televised meetings from there.
I cannot speak to the actual technology around that, but I do know that any requirement and we will have a dedicated AV booth, which is something we don't have now, but I cannot speak to the technology, and I don't see Ted in the room.
I think
but-
that does need to happen. We made a commitment to the public when the Travis County Commissioners supported, specifically my ask, that we televise our meetings. And so I want to make sure that we continue to do so without any.
We'll definitely broadcast. I think the question is a little bit more nuanced in my mind around, I don't think we have a television station, right? Or I'm sorry, a channel, but we definitely will broadcast, and we
Yes.
have the camera capabilities, et cetera, and a lot of, and we hope more robust AV technology in that
And
space.
one more thing, since we don't have really any control over what Community Care Board does, but there has been a lot of concern from the public that they don't have any portion of their board meetings public, accessible to the public. And I've been hoping that the Community Care Board would at least, since they're part of our enterprise, would allow that to happen, and at least for the first part of their meetings, public commentary, on any of their agenda items. But I think that would behoove us as an enterprise to show that we are in keeping with our commitment to transparency, to public knowledge and information and input. So that's another 2 cents of mine.
Thank you, Manager Valdez. Any last questions before we go into closed session?
Just one quick one. As we look at the facility, given, what time frame we're looking at, 24, 25?
Our current goal is that the building would be occupied the end of '25, but we're going to talk about that in a minute.
Okay, and the reason I raise it is because with the construction of, on 35, the possibility of access and regress to, the entrance to Hancock's area is going to be probably challenging. I don't know when that will occur, so I'm sure you're considering all those timelines in terms of.
More to come on that conversation in just a minute.
And the last thing, will I be able to leave out of there and go over and do my shopping at H-E-B still?
Absolutely. Yes.
That's very important.
No, I'm very excited. There's Joe's Coffee and H-E-B. Yep.
All right, so I announce,
I have a question.
oh, I'm sorry, Ann, I didn't see you, yes.
That's okay, just a quick one. I'm just curious, and this may not be the right, you may not be in this phase yet. So you can just tell me if we're not, but, the Manager Valadez question made me think about, planning for the future. And I'm curious about, the extent to which we are looking into the, I don't know what the right technical terms are, but basically the airflow in the building. There's, with us all coming off of COVID, there's been a lot learned about the importance of airflow in buildings, and some changes made in the industry, I think, around how you build a building that is healthier. And so I'm just curious if you all have gotten to the point where you're thinking about those aspects.
Absolutely, and mostly from a clinical perspective. So just so you know, we have a triage room, as we're calling it, on the community care side. We have an isolation room. This has an antechamber. It has negative pressure. We have several rooms where, the rooms are different to accommodate potentially infectious disease. We've had a little bit of discussion around tuberculosis and some other infection, the pulmonary diseases that may be present. I'm going to defer to the medical folks in the room on, some of the requirements of just the air, the HVAC systems in the air, quality for those clinical services. We are looking at the bigger picture, to your point, Manager Kitchen, as well. And a lot of it is because we are having to rebuild and build back all that HVAC infrastructure and making sure we've got enough. And it's not just for, I'll just be honest, that's not just for the health and safety of the people coming into the building. It's also, we have a lot of equipment that needs to be kept at cool temperature. So, but making sure that the filtration is good, making sure that where it's located and how we're pulling in. I mean, we are also adjacent to the interstate. And so, yes, we are looking at those things.
Okay, great. Thank you
Yep.
very much.
Okay, so now, I announce, there's no motion on this, but I announce that the committee is convening in closed session to discuss items 2 and 3 under Texas Government Code 551.071, consultation with attorney, and Texas Government Code 551.072, deliberation regarding real property.
Date and time.
Oh, and the date today is October the 18th, 2023, and the time is 1:45 p.m.
Brianna, I'm